Hi, everybody, and welcome to the Hanley Effect. I'm John Dyben.
I'm Rachel Docekal.
How you doing, Dr. D?
Good, Dr. D. How are you?
I could not be more lovely. We are going to talk about some things that what I find with professionals, and certainly with myself, but most professionals really struggle with. And it's interesting. It isn't the academics, and it's not even the work, but sometimes those of us that are really, really great at taking care of everybody else might
Mhm.
struggle a little bit with taking care of ourselves.
Just a little.
So I'm excited to have our guest today. Our guest is Dr. James Gordon.
Hi, Dr.
Uh,
Gordon.
how are you?
So glad you're here.
Hi. Dr. Gordon's a Harvard educated psychiatrist, and his specialty has been self-awareness, self-care, group support. And he is the founder and CEO of the Center for Mind Body Medicine in Washington, D.C. And it's something that that is such an important area for us to look at. Um, just so glad for you to be here. I know you are a busy person. Dr. Gordon, how are you today?
I am fine. I survived a long session with the dentist, and I'm here to tell the story.
Well, thank you double for being here. It's funny. I was just talking to my daughter about dentists and orthodontists today. She came back from the orthodontist and she had a good report. And I said, man, oh, I love a good report from the dentist. She says, yeah, I bet you do. You don't get those often, do you?
My dad was a dentist, so I think I have a different
Okay.
perspective on the dentist. A good report from the dentist is me not getting in trouble as a kid.
Not getting grounded.
Not getting grounded. That's right.
So, Dr. Gordon, we're going to be quiet and we would like to get to know you a little bit and let our audience get to know you. And so we always like to start by asking the question, kind of talk to us a little bit about who you are and the work that you do. And then we're really interested in whatever in your story and your journey that brought you to this that you'd be willing to talk to us about. So who are you? What do you do? And what are some of the things that brought you here?
Sure. Well, I'm Jim Gordon. I grew up in New York City. My father was a surgeon. Among other things, he was the Yankee doctor at the
Oh,
time and
no.
operated on Joe DiMaggio, among others.
Why?
And I was he was not an easy man, as happens with many surgeons. But the best parts of him came out when he was working with patients, and particularly when when I would see him working with patients in a public hospital, working with people who had no money, who had surgical emergencies, and I could see his commitment to them and his compassion and the relationship they had. So I'm sure that was influential to me early in my life. I'm somebody who's interested in stories. I was always a reader as a kid. And I was always the kind of kid in New York City, traveling on public transportation. Somebody would sit down, some disheveled person would sit down next to me and say, hey, kid, you want to hear the secret of the universe? And I'd say, of course, yes, please tell me. So I was always very interested in stories and getting to know people. And so I studied English at Harvard College. And then when I went to medical school, also at Harvard, I was pretty sure I wanted to be a psychiatrist because I was very interested, although I wanted to work with people on a physical level and enjoyed delivering babies and surgery and doing internal medicine. I really was focused on the remarkable possibility of a relationship with people and them telling their stories to me, of that being a healing process. So I became a psychiatrist. And from the beginning, questioned the medical model of psychiatry, questioned the whole, the sort of the overriding importance of the diagnostic systems, and to me, even back then, the overuse of psychotropic medication. I thought these people, obviously, they're going to be biological changes as well as psychological changes, but is this the best way to treat people with psychological issues as if they had diabetes or a diseased gallbladder? Why not treat them as whole human beings living in the sort of larger world? So that's what interested me right from the beginning. And that interest is carried through. And what I became aware of very early on in medical school was the incredible capacity of even the most troubled people, with some support, with some help, to be able to come to understand what had affected them, what had sort of turned their lives in a disastrous direction, and also by their capacity to right those wrongs and to move ahead with their lives. When I was a researcher at the National Institute of Mental Health, I became interested in, well, in addition to creating a safe place for people and talking with them and creating social support, which I had already been doing as a chief resident in psychiatry, and which I began to do with homeless and runaway kids when I was at NIMH, are there ways to work with them biologically as well that create that same process of transformation that psychotherapy and that a therapeutic community could do? So I started looking at sort of information about nutrition, exercise, their biological effects. I became interested in and learned to practice Chinese medicine, in which there is no real distinction between mind and body. It's all one integrated whole. And that was beginning 50 years ago, or actually a little
Wow.
more than 50 years ago. So what I developed over time is a comprehensive, holistic approach to working with human beings and to seeing that the same approach basically could work with people with psychological problems as well as people with chronic physical problems. And I did that, and I led a study for Jimmy Carter on alternative mental health services that examined how people were doing this kind of work around the country. Left NIMH after a period of time and did private practice and wrote for the New York Times and the Atlantic and the Washington Post and wrote some books. And then, but I wanted to have a larger effect on healthcare. So I started the Center for Mind-Body Medicine. And the idea was to bring, as you said in the beginning, to bring this approach of self-awareness, self-care, and mutual support to make that central to all healthcare, to the training of health professionals, and to the education of our children. Not exactly a modest goal, but I figured, okay, why not do whatever I could? And so 34 years ago, I started the Center for Mind-Body Medicine with no money, no paid staff, 25 volunteers, doctors, nurses, teachers, mental health professionals, and also a professional gambler, which I took as a good omen. He was very interested in our work. So we've been going, and just briefly, initially our work was, we developed a training program in mind-body medicine. A little while later, a training program in nutrition. A little while later, a training program to help people explicitly work with cancer patients. But in the beginning, our focus was primarily on training clinicians, training physicians and mental health professionals and nurses. When I began to see how well that program was going, initially in Washington, D.C., where I live, then nationally in the U.S., training people, we had a major focus on training medical school faculty, but they were not the only one. But it was going well, and I thought, well, let's see, can this same approach work in some of the most troubled places on the planet? So I began to go to some of those places and bring this approach there. And lo and behold, it did work. We were able to train many, many people in a number of places, which we can talk about. And they, in turn, were able to use this work, use this model that I and my colleagues created with thousands and thousands of people in many places around the world, as well as here in the United States. And so for the last 25 years, the major focus of the Center for Mind-Body Medicine has been working with whole populations that have been traumatized or under serious chronic stress. And that's what we do. We train people to use this model first on themselves and then with others. And then we provide mentorship and supervision. And we've developed programs in 8 or 10 countries and in many places in the United States. So that's the scenario. And the text for the work is this book of mine. This is my most recent book called Transforming Trauma, The Path to Hope and Healing. And it contains many more than the 16 techniques we teach in our training, and gives readers a feeling for what we do and how we do it and why we do it. That's a long answer.
Yeah. No, it's so beautiful.
So fascinating. I'm actually interested in how your field of study was impacted by the pandemic that that happened in the last 5 years. And we talk a lot about seeing really the deterioration of mental health and other things after the pandemic. Tell us what you're seeing and if you've changed anything as a result of it.
It's a great question. Well, of course, the pandemic was devastating for the whole population in a variety of different ways that, I'm sure that, kids not being able to go to school, being at home, parents kept out of work, everybody anxious all the time, separation of family members and friends. So I wasn't sure how we were going to deal with it. But because it was clear, instead of doing our trainings, and our work is really about education and training people, which had always been in person. Since we couldn't be in person, we had to bring all our educational work, all of our trainings online. What was remarkable to me, and I was skeptical in this work, what was remarkable to me is how well it worked. And I think obviously online communication became more important to all of us during the pandemic. But what we were able to do when we do a training, let's say we have 200 people in our training, 200 clinicians, educators, community activists, and I can talk more about how we train non-professionals now as well as professionals. But anyway, 200 people come on, they'd be in 20 small groups, because when we do a training, if we have 200 people, we have one group for every 10 of those 200. So there are 20 small groups led by 20 of our 150 faculty. We have 150 faculty worldwide now. And the level of intimacy that was possible, I don't know if you've seen this as well, was stunning to me.
Right.
That people could come on and really feel not quite, but just about as close to each other as if we were all sitting in the same room. The other thing that was really interesting is that we were then able to work with people all over the world whom we would not otherwise have been able to work with. So somebody in Africa who's got no money, who's trying to work with their community in Africa. So let's say it's a nurse or a community organizer. We would be able to give them a scholarship, bring them on screen, and they'd be in the same group as a doctor from the Midwest, as a psychologist in a war zone in the Middle East, as a woman, a covered woman, or several covered women from Ukraine, and an ultra-Orthodox rabbi from East Jerusalem. And I'm thinking of an actual group that I led. And so it's fascinating for all these people who would never have come together to be able to come together. And in the context of our groups, where we don't let people analyze or interpret or interrupt, where people are there to make discoveries and learn for themselves, how they were able to learn from and come to respect each other. So that's how it shifted us. And we still do. We have online trainings now twice a year. We have a sequence of our initial training where you learn how to use all these techniques on yourself and you participate in a small group. And then our advanced training where we coach you and help you, and you have the opportunity to actually lead a small group. So we're doing all of that online, and it works. I mean, I still would rather be with people. Not so long ago, we did trainings in Ukraine, and we were able to be with people there. And it's wonderful to be with people and to have that sense of connection, to have a meal together, hang out after the group, and so on. But we can do it online, and it goes really, really well online. I think
Or
COVID, you're mentioning COVID, people still have recovered from COVID, many, many. I don't know, you're nodding, and so I imagine you've seen this as well.
absolutely, we see it. We see it in patients and families. One of my I'm a family therapist, and I remember realizing I'm going to have to figure out how to do family therapy online, and thinking this is never going to work, and being shocked at how intimate, if you do it, that you can create these very intimate. It has expanded my whole idea to where sometimes, I'll still do family therapy on, remotely, and it's incredibly effective. And you found that exact same thing. The message is the same, the work is the same. You just adapt it to a different methodology because we had to. And that idea of
Yeah.
COVID.
So people are still, a lot of people will still say, I'm never recovered. My kid,
Yeah.
especially I don't know if you've seen this, my kid, really haven't made up everything that they've lost. Plus, I think the other thing about COVID is that sense of vulnerability that people have. That there was a sense that those epidemics, pandemics that happened on other continents that didn't happen. Very few people
Yeah.
remember the polio epidemic, but since then we really haven't had anything like that up until COVID, and that has shaken people. I think, and we don't. I don't know that it can be exactly quantified, but my impression is that people have ever since then have felt more vulnerable in a variety of ways, not just to viral infections, but just a sense of insecurity that's there.
And is that, your work, part of the work you do is with people who are, chronically under chronic groups of people who are chronically under stress. You're talking about people in war zones. You're talking about people, and does it kind of enter that kind of increased anxiety? Is that just a normal part of entering into the group psyche when there is a crisis like that?
Yeah, I think so. I mean, as you say, we've been working ever since um, ever since we spent time in Bosnia, and then began to work as soon as the war began in Kosovo, and that was because this is 1997 that we started working in Bosnia. We saw the damage that war had done to the whole society, psychologically, physically, socially, spiritually, economically, everything. Um, so it became clear that the time to work with people was not when the war was over, but as soon as the war began. So a colleague and I
Mm.
went into Kosovo as soon as the war and began to work on the ground. And that's been uh, ultimately our work in Kosovo became a kind of pilot program. We worked in Kosovo and Macedonia during the NATO bombing, back in Kosovo as soon as the bombing was over, trained 600 people, and our work became central to the community mental health system in Kosovo, and still is 25, 26 years later. But that became our model. We want to go someplace as soon as something happens. So much of our work in the United States has been with communities that have suffered mass shootings or climate related disasters, whether Sandy Hook, Parkland, Uvalde, uh, and then uh, we started working with climate related disasters with Katrina in 2005, and have continued to do that in California, in New York City, now in Texas after the flooding. We're working there with people. So the idea is to go as soon as possible and to offer to people, here we are, and we can help you deal with the overwhelming stress and trauma, give you the tools you need, help you come together to support each other, and also help you build long-term resilience. So that's our work. And um, sometimes we work in communities with, as you mentioned, with more chronic stress. So, for example, an Appalachian community devastated by the opioid epidemic.
Mhm.
We work with the largest division of the VA, where there's tremendous amount of chronic stress among the veterans and among the staff of the VA as well. But our focus really is on as soon as we can, let's go and let's partner with these communities that have invited us in, and let's see what we can do together.
And thinking about somebody listening to this right now who's got a heart to help people who, but they say, but you're a Harvard, educated psychiatrist, you've got all the credentials, you can deal with people's trauma. What I hear you saying is that it's not just physicians, it's not just psychiatrists, not even just professionals or therapists. So what would you say to that person that says, I don't have those credentials? What can I do? How can I be of any help?
We can train you. We can train you to do it. We discovered this in Kosovo, actually, in 1998, 99, 2000, as we were training people there. We trained, as I think I mentioned, 600 people in Kosovo. One of the areas we worked in is called Surreka. It's in the south of Kosovo. More than 80% of the homes were destroyed, and 20% of the high school kids lost one or both parents. So an area of major trauma. When we were doing a training in Kosovo, a group of teachers and the principal of that high school came to our training, and they wanted to bring it back to the high school. We said, okay, great. In Kosovo, there were not many psychiatrists. There was two psychologists and 0 clinical social workers. So the whole psychotherapeutic enterprise was just about not there. The psychiatry was basically biological psychiatry. So these people came to the training. They went back to Surreka, and they were doing what looked like a really great job with the kids in the high school. And so we studied what they were doing. And we did a preliminary study, and then we did the first randomized controlled trial, which is gold standard of medical psychological research. We did the first RCT, randomized controlled trial, of any intervention with war traumatized kids. Nobody had ever done this with psychotherapy or drugs or anything. And 12 weeks of groups where these high school kids, all of whom qualified for the diagnosis of PTSD, 12 groups over one group a week for 12 weeks, and 82% of the kids no longer qualified for PTSD diagnosis. Those gains held at 3 months follow-up. It was a landmark study. But what was just as remarkable is the people leading that study were not people like us. They were rural high school teachers with no background in psychology, except for a course in pedagogy, whom we had trained. But they were smart, they cared about the kids, they were willing to learn on themselves, and they were willing to get supervision. That made it clear to us we can train people who want to do this work, who are committed to those things, to initially learning all these tools and techniques for themselves. You can't help other people help themselves unless you're also working on yourself. Otherwise, it's just theory, and nobody's going to pay too much attention. And you don't know both the benefits, but also the challenges. It's not so easy, particularly if you've been seriously traumatized. These teachers did a great job, and that led us to understand that we can train people who want to do this work, who care, who are intelligent, who are willing to work on themselves. And that's how we're able to do population-wide work. So I would say to this person, if you're interested, check out our website, cmbm.org. Check out our schedule for trainings and come to the training if you'd like. All we're asked of you is that you're willing to work on yourself and you're committed to sharing with other people. And we can give you the training. And if you'd like, we can provide ongoing supervision and mentorship. And so that's what we're doing. Just came back from Navajo land in Arizona and New Mexico. About 800 indigenous people have come through from North America, have come through our training. And I met with people
Wow.
there who don't have the kind of background. They're tribal elders. They're community women who are community activists. They're
Yes.
doing a great job. We invite people to come to our training. We want to train you. And the thing is, if there's a place in your community, it could be a church, a synagogue, a mosque, whatever, could be a shelter for homeless people, it could be a after school program. We're very happy to train you and then to help you get started working with other people. It's enormously satisfying to be able, and your question indicates that people are looking for how can I contribute to my community? And if this way appeals to them, we can train them and help them do that.
I love that because I think there are many people and in this that want to help in their communities. We see,
We
you
just
know,
don't know how.
the from school shootings to the floods to hurricanes to there are things that really traumatize a community. We have lots of them here in the United States all the time, and we have the opportunity to work with the Seminole tribe, and one of the things I've learned with folks over times it is that especially as we're working with natives, they're far more interested in whether you are a trustworthy person than they are in your credentials. And so the fact that if you can train those strong women in the community, the medicine men in the community, you have an end that all your degrees and all our degrees combined could not get a foot in the door. But you can train those people. Such a beautiful model. Um, I'm the bad guy.
Ugh.
I always have to be the bad guy. I have to wrap us up when it's time. There's so many more questions I have for you. So many things I want to talk about. I'm going to be reading up on you over the next few weeks because I have a tremendous interest in nutritional psychology. Took a program in it. I think we miss that so much in mental health, the power of nutrition. And so hopefully we'll get another chance to talk. I could probably do another half dozen if you can get it in your schedule. We can just back to back. But I want to thank you so much for being here. We always like to let our guests have the last word. And so thinking about we have a wide variety of folks who are our audience professionals and non-professionals. What is the one thing that you would want folks to hear from Dr. Gordon today?
Relax. You can learn to do this work. And I say relax because one of the things about doing work the way we do it is the burden is no longer, it's no longer so much on me. My job is to be a teacher. Um, I don't, I don't have to fix anybody. I don't have to make things happen. I'm in a role where I'm giving people the sort of the safety, the safe place, the compassionate presence, and I'm giving them the tools to understand and help themselves. So I encourage everybody who's watching us to consider this as a way to enlarge what, if they already are in the professions, to enlarge what they're doing. And if they're not in the helping professions, consider this as a way to enter the helping professions in a way that they can enter doesn't have to be a profession, enter the world of being a helper and use these tools with others. And I also encourage people, as they say, read my book. Take a look at the book itself is designed to help people I wrote it for people who might never see me or you or any other professional so that they can use it to help themselves deal with trauma and stress. It's called
Tell us again
Transforming
the
Trauma.
name and
Uh,
your website. Dr. Gordon, tell us again the name of your
It's
book and the website.
sure. The book is Transforming Trauma, The Path to Hope and Healing. And it's published by Harper One. It's out in paperback. You can get it, listen to it. It's in 10 or 12 different languages. So it's easily available. The website is cmbm.org, the Center for Mind Body Medicine. Charlie Mary, Betty Mary.org. You can read about all our programs. I'm demonstrating some of the self-care techniques. You can just take a look, do them for yourself, and be in touch with us.
Love it. Dr. Gordon, thank you so much for your time. As always, Dr. D, thank you.
Dr. D, it was wonderful.
I have so many more questions.
I know. I
We'll be
can't
back.
wait to read the book.
For everybody who's listening or watching, thank
I'll
you
be
so
happy
much.
to-
I can't wait.
Thank you.
We'll see everybody next time on the Hanley Effect.
Bye, everyone.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.